But what does that 501c3 structure look like? I mean, it seems like because it's dissolved, because Brim and Community aren't there any longer, you now have kind of developed your own 501c3 with really, there's no association or.
Who's ahead of it?
I mean, it is kind of.
Who's the head of the 501c3?
Confusing.
Well, the governance of the board, and then it would be the CEO.
Steve Cardy.
The structure did not change when the association with Community and Brim went
Ended.
away. And we could, if we chose, in a sense, possibly, and we still have a nonprofit corporation running the hospital. If you went back to the hospital district and got rid of the 4 corporate directors, then you'd be down to 5. Quite honestly, I think there's enough work
It's-
to be done for the
it's a
directors
lot.
and spread
I
over
think
enough
that's true.
people that I wouldn't wanna see it go back down to 5. And I think, you know, it's not like 9 is too many, that it's not manageable. It's not, and certainly, we have some people that are not elected district trustees who bring quite a bit of expertise to the board, and I would not wanna have to do business without having their input. You know, so I don't see any reason to turn it back, and I've also not, and I think I said this last month as well, I've not seen a single case where I found there was an issue in which the elected trustees sat on one side of an issue and the corporate members sat on another. We've all always talked things over, listened to each other, and come to a consensus. So I don't see any negative either for the board, the hospital, or the community in having those 4 corporate additional trustees. I see an awful lot of positive. In fact, one of the things with the health center that came out of the HRSA visit is they push for a larger board so that they can have more committees to do more things. I think it'd be a tough road to hoe with only 5
There's-
right now.
There are so many moving parts and so many regulatory issues that we deal with that it is a lot of work, and it's a very, very steep learning curve to figure out what's going on. John?
I was the CEO of a hospital in Arizona a number of years ago, and we had a hospital district as well as a corporate board. The hospital district had 5 members, just like here. The laws are much the same. That hospital district built a hospital and handed it over to a corporate board to run. And they backed off. They met once a year, and that was all, and they didn't have anything to do with the hospital. Except when an issue came up to have a tax levy, they got involved, ran the tax levy, and then backed off again. So this is one way to do this, but I've seen other structures where the corporate board had only corporate members, and the trustees knew they owned the facility, but they didn't do anything. They'd have a meeting once a year, maybe, and didn't even ask for reports that often.
So are meetings happening once a year now with these 2?
No.
I
They're
think-
together.
We
It's
meet
once a
monthly
month.
and
We meet
together.
at least
month-
once a
Because I
month.
think that's
monthly.
what's confusing for the public, is that, I mean, here you have the facility and tax levies. You hear about a new hospital wanting to be built, but there's this 4 corporate appointed
Mhm.
members. You guys don't have any congruency. I mean, coming into this community and seeing it, you'll never get a hospital built. And sitting around listening, there's so much defiancy and just anger in this room. I mean, I am appalled. This is our community, and those 2 entities need to work together. The community needs to work together. You guys need to have your support, and you need to be able to
Oh, yeah.
answer questions articulately and appropriately, and make sure that you're getting the backing of the people. You know, and I apologize, I'll get off my soapbox, but I'm a little taken back by sitting in this meeting, and kind of there seems to be lots of finger pointing. I get that.
Mhm.
You guys are in the paper right now. You know, the best thing to do is to be able to provide answers to the public and say, these are the things we're working on, this is the direction we're going. We do take you guys' interest to heart, we're here for you, you know. I think that's the most important, and the quality of care for the patients, so.
Sorry.
I have a question for John.
Sure.
This hospital you were talking about that you were a CEO
Right.
in Arizona, was it a nonprofit funded by taxpayer hospital?
It was a nonprofit. The funding of the district board was funded by a tax levy. It was about, $1 million or something like that a year. The hospital was doing 13 million at the time. It's now doing 600 million a year. And the elected members of the Board of Trustees for the district have very little to do with it. So the hospital has grown well beyond that, and they no longer even talk to the district to get funding. They have enough revenues flowing through that they can go out and get bond issues without using that. So it's just, it's a different structure, but it was based on a little bit the same because we had two boards. We had a district board and a corporate board, and they were separate. But when we came to a tax levy to build a new hospital, the district board became very active and met for about 5 months, put that together, there was an election, and then they don't meet anymore. So they own the facility, lease it to the corporate board, and that's how it was. And here, the two boards are together. So the hospital district side of it is part of the running of the hospital. And in fact, it's a majority.
I think what Amy has described is a very legal definition for how they are organized. But we have lost our identities as members. We have completely integrated into one board. We don't meet separately. You'd have to ask who's who. That's how close we've become. So it isn't two different boards, two different meetings, two different functions. We really function as one board, with the exception of the facility and the taxes. That's it. But I've never had any reason to meet with another group or separate from the other group. So I think, I hope we're not making a mountain out of a molehill.
Yeah.
After reading the last contract you gave Steve, what do you guys have left to govern? You pretty much gave him a free rein to do just about anything he wanted. You gave him he could hire a COO, he could do, if you read his contract, you just about let him do anything he wanted to do. So what is it actually?
First, I'm wondering, how did you get a copy of his contract? Because
You gave it to me.
I did not give you a copy of his contract, I gave you a copy of the bylaws.
And on the back part of it was a copy of his contract.
There was a job description for a
Fine,
CEO.
job description.
Okay,
It pretty much,
there was a job description in our bylaws.
yes.
But that's the role of the CEO, that's what
Right.
the CEO's
So what are
role
you,
is.
he brings you whatever he wants to bring to you. What do you actually govern?
We tell him yes or no.
Yeah, we
Yeah,
tell-
you tell him yes or no.
No, that's true.
Um,
That's
That's
all
true.
you do?
That's part of-
Is
that's
just
part
tell
of-
him yes or no?
That's part of the arrangement, you know, a lot of the policies and things come down from the board. We're supposed to be directing the CEO in the direction that we want the hospital to go.
We do not run the day-to-day operations.
I
of the
realize
hospital. You can't meet once or twice or 3 times or 4 times a month and run the day-to-day operations of the hospital. It can't be done unless you're here every day, because you're not gonna have a full understanding of the intricacies. Just can't be done that way. We're responsible for overseeing management, and that is what we do.
Well, you were mentioning things you had to do with
With committees and.
yeah, committees
Yeah.
and paperwork that was necessary for you to
Yes.
comply with.
Yes. So, for instance, we had a finance committee meeting prior to this. We go through, the budgets and we question, why is it this way? And where are we here? And where's our accounts receivable? And why is it that way? It's our job to ask those kinds of questions to make sure that we know what's going on and that we can have a handle on what's going on.
Where are these meetings posted?
I don't know if we have to post committee meetings because they're not
We don't?
quorums. Because we can't vote on anything in a committee meeting. All of that gets presented to the board.
Yeah.
So during.
But they are
I mean-
open to the public,
Yes, they are.
so how do I find out when you're holding them?
We can,
We can post them.
we can post them.
Yeah.
We'll post them.
Post them.
Where?
Well,
we-
where have we been posting, the regulars?
Durango's, Castles, and the post office.
Yeah, those 3 areas, Durango's, Castles, and the post office. And it's
Is there
also
somewhere else
posted
that would be
in St. Regis.
No, I
additional
just
that-
was, no one told me that you changed the meeting from 7 o'clock to noon.
It's been
posted for a while,
Yeah.
yeah.
We didn't change it.
Well, we changed this month, we changed.
Yeah, it was
In-
gonna be 7 o'clock.
in
not-
the-
yeah,
Right.
Yeah.
We're required as far as the open meeting laws to give reasonable notice, and that's been defined as like a 2-day notice. We try to do, I know, but that's what it's been defined as. We try to give you a lot more than that.
Right.
Well, and we
Sometimes things
schedule-
come up quickly, you know, whether it's some, you know, I know that there have been times when we have to call a special meeting. We gotta make sure we have at least that much amount of time to be able to schedule.
Do you post the meetings on your website or?
No, currently, but I think we're kind of have an issue with being able to update our website right now. But
Darn it.
it should be, I know, it should be.
That makes it tough.
Yeah,
Yeah.
it should be. We're trying to resolve that issue.
How about the Mineral Independent?
Because of the way the deadlines are with the Mineral Independent, you have until Monday, I think.
Monday noon.
We try to get them in there, when there's sufficient notice that we can get it in
Don't the county commission, do they have a website that they
Mhm.
often update? Could you
there.
post information
No,
there?
no,
They
but that's a
don't?
really
That's
good
good thought.
That's a really
And
good
it's-
idea.
And they do have a website.
Yeah.
And they do
But-
update it.
I see somebody shaking their head going.
They
They
still
still
have
have Clark listed as,
They what?
they have Clark Conroe
Oh, yeah.
listed as a
Oh,
commissioner. They
really?
have the
Really?
same problem that they're not able to change their website, they have to go, so they're working
But do
on
they
it.
update that meeting schedule? Because it seems
They
like it's
do.
Yes.
updated frequently.
'Cause I get it.
Schedule list, yeah.
So if you could just put it on there, I mean, that shows.
I think all we have to do is let Cindy Grimm know.
Yeah.
Yeah, yeah,
We
that's
can
good.
certainly do
Yeah,
that.
Cindy does an email list, and maybe that's
Yeah.
what you get.
Yeah.
And maybe
Yeah,
that would
too.
be a good, maybe that would be a good
And
way
maybe
to
even the
disseminate
Good
that.
chamber.
idea.
Yeah.
Chamber has a good mailing list.
Oh, see, I'm not on the chamber list.
Yeah, the chamber has a good list too. Yeah,
Yes,
true.
excellent.
Yeah, and they post things
Okay,
fast.
we can do that, that would be awesome. I'd like to get moving, were there any other questions with regard to that? Does that help clear up things a little bit? I was hoping to clear some of that up. Okay, thank you
Thank
for all
you.
of your comments. All right, let's move on to board training. And we don't have anything very specific with that, other than, next month Julie is going to be giving us one about HIPAA and some of the HIPAA regulations and laws around that. There's 2 things, we have coming up is, what's this first? On October 3rd, at noon, there's a Yellowstone, who is our insurance carrier, will be hosting a webinar on hospital board responsibilities and liabilities. So this program is designed for board of directors, administration, and leadership to review in detail their legal rights, responsibilities, and whether the board members are subject to liability if sued. That's one of the issues that we've been discussing over recent months, and I believe we have it set up here. We have where board members can come, or
We
where
have,
we
it,
can-
yeah, we were gonna, that was part of what the discussion was gonna be today. was
Today,
whether
how we
everybody
want-
was gonna be at their homes and do it, or.
So I didn't get a lot of
It's an
feedback.
hour long.
It's
right?
an hour,
Yeah,
yeah.
so.
I would like to have something set up here so that people can come, because I'm gonna come here. I would like to have something set up here.
What's the day of the week, October?
Thursday.
But if a board member doesn't wanna come here, they can register themselves and do the webinar at home, but I would like to have one centrally located where we can do it here. Do we have, or are we able to do it in this room, or is there another room that we need to? And have we registered for this already?
Not yet. What time is it on?
It's at
the-
noon.
There's a clinic staff meeting here Claudia sets up, I think it's a running meeting. But I do have.
Could we meet in the day room then, at the back of the hospital?
Do we have
There's
a?
no computer.
There's no
Yeah, we need a
computer there.
computer to be able to-
You have to-
Or screen or
I'll
whatever.
make
it is.
sure
to a webinar.
with her if we can get this room right
All right.
And if it ends up changing, if we could post it on the door so that we can locate it. And I think that's important. We need to know the information. The other one that came up, is on October 18th. There is a seminar with, our law firm about the Affordable Care Act, parental leave law, social media, background checks, and employment discrimination, employee absent laws, bullying, and much more as far as employment law seminar. That will be happening on October 18th, and to register for that,
Is that
Is
also a
that-
webinar? That's a webinar as well?
No.
No.
But that's,
No.
where that's held.
that's, it's in Missoula.
Okay.
I think they put that on every year.
Uh-huh.
I think they do the same thing every year.
Do we need to register for that individually?
It's every other year we
Oh,
put
it's
it
every
on.
other year.
Oh, every other year.
Yeah, and there should be a link in the email that I sent you where you can click and register online. I know Stacy's
Mhm.
planning on attending. You all don't have to attend, but it's probably helpful, just to kind of give you guys an overview if anybody wants to attend. It's free.
Is there a deadline?
I don't think so, but you probably want to register sooner rather than later. It's held at the Hilton Garden Inn in Missoula, and it's a day long, and there'll be a packet that goes with it.
Okay.
Materials and stuff.
Okay. So just keep everyone aware of that. I'm planning on attending both, so. I know Carol said that she was wanting to do both as well. So that's what I have for board training. Can we move on to our approval of minutes? Did everyone have a chance to go through our minutes, both previous meeting minutes, we have special meeting minutes and finance committee meeting minutes? There's quite a few. I hope everyone had a chance to go through those. Do we have any changes?
I think the only change I had was on a couple of them, they still have me as
Vice chair? You don't want to be vice chair?
We could make a deal.
With those corrections, I'll move we approve the minute packages.
Thank you, John.
I'll second.
Okay. Any other discussion? All in favor of approving the minutes?
Aye.
Aye.
Any opposed? I didn't hear Jim or Gary.
Oh, I fell asleep.
Furiously reading. Did you have a vote?
Approved.
Approve?
Approved.
Okay. Okay, consent agenda. I had some questions. I had a question for Monty about, you were on a radio interview? Is that what I understand?
Yes, I was in Missoula last month as a guest host on KMSO FM. And primarily, it was just to talk about Mineral County, what we have for health services up here, and give away some fried chicken, which is one of those type of deals, you know? Come have a little fun and talk about what's going on up here. And people called in, did not even know we had a hospital up here. These are from Missoula mostly, and the Hamilton area. So if anything, it was just a little outreach to let them know that we do have a facility. We're striving up here, we're on I-90, and we offer quality health care. Oh, great. You're calling.
What kind of questions did you get?
How long's the hospital been there? How big is the hospital? how does the governing board work with the trustees versus the corporate change?
Here, I thought you were serious, like.
I know.
no way.
They're just.
Monty,
real-
serious? Come on
Yeah.
now.
Just simple, fun questions.
Okay. I was just curious, cause you said that they were calling in with questions
Yeah.
and I just was curious. what
Just
those
so many
questions-
people didn't know that there was anything out here. They thought that the last hospital, there might have been a clinic in Frenchtown, and that was it till you got to Idaho.
Did you invite him to come this way?
I did.
Oh, very
I
good.
said, they're coming, we're gonna get them enrolled.
I had some questions for the DASH report. I don't know if we should hold that till our quality discussion. But, I'm looking at some of our numbers and, not the financial numbers, we're gonna talk about that. But I'm looking at our observation hours and I wanna know what happened because they are like a third of what they've been. Are we not having?
Amy, observation is a status that a provider can place a patient in. An observation is where the provider's not able to make a medical diagnosis and there's more testing required. It's hard to say without looking at all the charts exactly, but my hunch would be in this case, the patients that the providers were seeing, they were able to make a medical diagnosis and admit them as patients rather
Okay.
than placing them in observation for any length of time.
Okay. I was seeing, 240 and, upwards of there, and then it was at 81 this month, so. Just didn't know if there was a reason that we needed to be concerned that there's some issue with, just people being shipped off and not being put in observation hours,
Now,
or
what would
what's in it?
what would take you to ask to have that concern? Where would that concern come from?
I don't know, I just didn't know. Just the question that I had.
But it is a big drop off.
Well, if you look at
It's a
the
third. Yeah.
acute average length of stay in hours,
Well, and because I was looking at our
Then
swing beds and our
those
long-term
hours
care
are-
beds, they were all up.
those are up.
So,
So those observation hours, instead of being observation, went into one of the other categories.
Yeah.
Because there
Yeah,
wasn't
I
the
think
and that
so.
makes sense to me.
Yeah.
It,
Yeah.
it is misleading that it's red though, as if it's somehow failing, when really it doesn't sound like it's.
Really, what it indicates is that it's 20% off target or more from the budget.
Okay.
Well, and if
I
you-
guess we would make our acute admissions a greener green.
Agreed.
There you go.
Yeah, and actually, if you look at it, that's obviously an area where there's big swings in the numbers before this month, too. You went from 159 hours to 240 hours between, or your average versus your July number, so it's, your July number's way above, and then, so it's a number that has big swings in it, it looks like.
I'd like to take you a minute and tell you about how we monitor that, whether or not the provider is placing the patient in the right area for care. We're required by law to subscribe to criteria that we use based on clinical research to determine, you take a patient's clinical signs and symptoms, their comorbidities, and how they present, and the provider looks at that, and we make certain that the provider assesses everything that needs to be assessed, that patient's condition is represented in the provider's documentation. We take that and we hold it against this criteria, and we do this on 100% of our cases. We're required to do it by law. And when it passes that criteria, we know that they're placed in the appropriate level of care, whether it's an admission or they're placed in observation. When any questions come up about that, if there's not enough documentation to support where that patient was placed, then our utilization review coordinator, Angie Millen, will contact the provider, bring it to the provider's attention, ask for either additional documentation or a change of status. The doctor is always allowed to say that this patient's condition is an exception to the general criteria, and my medical judgment stands. And then if it ever came to the point where we were audited by the federal government, then that provider would have to be willing to stand up and say, in my medical judgment, I made the right decision here, and this is why. So I just wanted to let you know that we do review 100% of those observation cases.
Thank you, Kirsten. Are you ready to move on? We need to approve the consent.
I would move to approve the consent.
Second.
Thank you, Ken. Thank you, John. All in favor?
Aye.
Any opposed? Okay, unfinished business. That's your-
October, which requires about 10 laptops, which Community Medical Center's been really good about helping us with, just on a temporary basis. So, last week, I believe, was Deb's staff training on learning how to run the financial piece, and I believe it's clinical in October. Our go-live is still on target for the first week of December.
Okay, I heard it was moving to January, is that?
Not that I'm aware
No,
of.
okay.
Not that I'm aware of. It's common to move the go-live dates, but so far, we're still headed for December, first week of December, unless there's something else that comes up, but.
Have we done any dry runs?